Joining us here on 23 ABC News, I'm Veronica Morley, your senior reporter. A new letter from Democratic lawmakers is sounding the alarm over potential health care cuts that could impact rural communities nationwide. The letter addressed to President Trump and Republican leaders in Congress warns that a House-passed reconciliation package would slash more than $1 trillion from Medicaid and the Affordable Care Act and trigger over $500 billion in Medicare cuts. Lawmakers say that could strip health coverage for millions and push hundreds of already struggling rural hospitals closer to closure or service reductions. 2 local hospitals made the list as potential facilities that could face deep financial strain due to the cuts to Medicaid and Medicare, including Adventist Health Tehachapi Valley. Now, while the CEO of Adventist Health Central California tells me they do expect some changes, he's not sure why Tehachapi was singled out.
That is not a hospital that I go to sleep at night worrying about.
Adventist Health Central California President Jason Wells says 80% of their patients rely on Medicare or Medicaid. And with reimbursement rates potentially dropping, the ability to keep up with growing needs could be at risk. However, he notes that a recent letter highlighting their Tehachapi facility as a risk among rural hospitals is inaccurate and alarming.
I don't know how Adventist Health Tehachapi Valley ended up on that list. It is a thriving hospital. It is in a mountain community. The community is so loyal.
With 8 hospitals and over 130 clinics across Central California, Wells says the entire network is bracing for ripple effects.
There will be many Central California hospitals that will struggle because of this bill.
For their hospitals, relying on shared resources and physicians helps mitigate some of their losses. But with more cuts coming, additional financial pressure could further stall growth and recruitment.
We understand there's some help coming. There's a $50 billion fund that's been created. But what we need help on is the definition of rural. What is a rural hospital? Because we have, 8 hospitals across Central California that all, to us, would fit that definition of rural.
Wells adds the system remains committed to providing care, but says both the state and federal government need to act quickly to avoid further delays in serving some of California's most underserved communities. Well said on Wednesday, hospital CEOs district-wide are set to meet in order to discuss these changes, as well as hear from state officials about what to prepare for. In Tehachapi, I'm Veronica Morley, your senior reporter.